Okay, so video number 12 here. It's May 26th, Friday, 2019. And so I just got back from my 18th radiation treatment. And this is the week where the side effects really start kicking in. Like right around 15, this Tuesday, was when the typical side effects started kicking in. Yesterday was really rough for me. It's had a gut wrenching nausea, and I don't know if it had to do with the radiation or not, or my taste has changed. Like all this week, things have tasted really weird. Like from last weekend to today, it's progressed worse and worse. Like yesterday, everything, and today too. Everything tasted super salty. Like you just got the taste of salt in your mouth. So like when I ate dinner, like if there's salt on it, it's like somebody just dumped a whole shaker of salt on your dinner. It was horrible. So I've been kind of dealing with that, but the doctor says I do need to maintain my weight and make sure I'm taking on calories and things like that. So yeah, so this is the suck week, so as far as my treatments, I have 2 more weeks and 2 days. So I'm just gonna muscle through this last back end of it. On Tuesday it'll be 20, and I'll be 2/3 of the way there. So I'm looking forward to just getting done with it. Take a look at my scar here. So today is exactly 2 months post-surgery. So this is what my scar looks like 2 months after the surgery. Still, you can kind of see it's a little puffy right here, and I'm still kind of swole up right here. I'm still numb all through here. I'm getting the feeling back little by little, just like all my other videos. I keep saying I feel the tingling and get a little bit more feeling back, and it's kind of trickling down. But right in here, it's completely numb, like right there. And then I still, like a lot of people I've seen on my parotid group, they ask about, when they have a lump, and they want to know when that lump's going to go away. Well, I'm 2 months, and mine is still there. But it kind of puffed right back up after I started radiation, so I don't know if that had something to do with it. I'm kind of swole up through here, so 2 months later, I'm still swole up. Don't know how everybody else is, but that's what's happening for me. And then I didn't shave on purpose to kind of show you my hair loss is starting, and it's like right in here. So luckily enough, I get to keep my goatee, and my wife's real happy. So that's a good thing. But yeah, like I said, things are tasting awful. There's just kind of no way around that. A lot of people talk about losing their taste, which I would almost take that over everything tasting salty, but that's how it is. And I'm waking up every day pretty much with a dry tongue. And then when I do get saliva kind of going in my mouth, it's pretty thick. I think that's what the saltiness is coming from, and the weird, odd taste. But my oncologist was saying to kind of keep everything to the right side of my tongue, because they're not treating this side for me with radiation. And so I should be able to taste everything a little better on this side. I'm completely off soda pop. It tastes disgusting to me. And if anybody who knows me, I'm a Coca-Cola kid, man. I love my soda pop. But it's just not happening. So I'm kind of down to Gatorade and water. That's about the only thing that tastes decent to me. Water tastes like they took it straight out of Lake Erie. It tastes pretty gross. But you can't go without water, so you got to deal with it. So that's where I'm at today. And I'll do another couple videos throughout the tail end of this radiation, let you folks know how it goes. But like I said, yesterday was a real rough day for me. I slept most of the day. I felt awful. Everything tasted awful and made me sick to my stomach even more. And you kind of go in rounds with this, I guess. It's like 1 minute you feel fine, you're fine for a couple hours, and then you feel sick to your stomach a couple hours, and then you're super drowsy. but I don't know if the drowsiness has more to do with the pain meds they have me on. I'm on gabapentin, which isn't like a serious, it's not an opiate or anything like that. And by the way, I had to take Oxycontin with my surgery, and I had that for like 2 weeks. And oh my God, I was never so happy to get off of something ever in my life. I don't know how that is an addicting drug for folks. I couldn't wait to get off of it. And I actually kind of came off of it earlier because it was so horrible. But anyway, so I'm on what's called gabapentin, and I've taken it since I started radiation, and your system builds up with it. But one of the side effects is drowsiness, and man, it does make you sleepy. But yeah, so it's mainly just, I got saltiness on my tongue. I'm waking up with dry tongue, dry mouth. And then when I do get saliva, it's thick saliva. So I'm hitting all these typical things of radiation. My oncologist says that the inside of my mouth looks really good. I don't have any blisters or anything like that, but I've been keeping up with, they gave me I think I said in my last video, saltwater rinse, and it's saltwater and baking soda, and you swish that around in your mouth a few times. He's given me, I'm going to go pick up something today that kind of helps with the saliva a little bit. It's kind of like eye drops. Eye drops lubricate your eye. This is the same thing, just for your mouth. And outside of that, just kind of muscling through it. So 2 weeks, 2 days left, and I'll be done. But I'll do a couple more videos right on up to the last treatment, just so everybody can kind of see what's going on. So thanks for watching.